is 350, right? This is your passing score. Now, in sequence, this is the last exam in OET. First of all, we have listening, that is followed by reading and writing. These three exams will go, they will take in one go, and after that there will be some break maybe, and after this break we have speaking subtest. In most of the centers, this is your basically the last subtest, and it's going to happen on the same day, right? So let's start with the speaking. What we have in the speaking subtest, first of all, we have warm-up session. As the name indicates, in the warm-up session, there is they're gonna ask you some general question. For, let's say, depending upon the interlocutor, it could be a simple chit chat. The purpose is to make you comfortable with the interlocutor, acting as a patient interlocutor. Actually, they can also ask something about your profession, let's say, or your professional achievement. They can also ask your plan, that why are you taking OET. They can also ask you, let's say, why you have selected UK as a career choice, and so on. So these are few nature of questions that they can ask in the exam. But the plus point is that there are no marks, there is no grading for this part, right? So as name indicate, it's just the warm-up session. After that, you will be given role play card, the second part of the exam in the speaking. In the role play cards, there will be two profession specific tasks. As we had see that the second part is the role play card, you will be given two profession specific task. So first of all, let's understand the structure of the card. Then I'll show you the card as well. But let's say if this is a point 1, this is 2, and this is 3. So what we have in these 3 points, let's say, the first thing is the setting. If you can draw this card again, let's say. The first thing is the setting. The second thing is the history component that you already know. And the third is that there are different tasks that you have to achieve. Now, let's explain it in detail. First of all, what we have in the setting. Setting mean it's your ward maybe. It could be your emergency department. It could be intensive care unit. It could be your, let's say, they would mention suburban clinic. So these are few settings, or maybe it could be, let's say, I would say, workplace assessment, workplace assessment, less likely, but we can expect. So you can see there we have these different settings that we can expect in our speaking. That is followed by your history part. In the card, when you receive the card, you can see that, let's say, if this is the history, if this is the history, this belongs to the history component. So history can be divided into two parts, let's say. This part belongs to the background information, and this is the presenting complaint or the active issue. Normally, this is the main problem we can expect over here. And that is followed by the task that has to be achieved. So what we can expect in the task, normally they can ask you about the inquiry, like you have to inquire something. We can go for the let's say explanation. In the explanation of the diagnosis, for example, or maybe any medical procedure, and so on. We can also have the assurance in card, reassurance, advice, and so on. So these are few of the things that you can expect in the speaking role play card, right? If we can say in the clinical communication skills. So this is the first criteria, is the clinical communication skills. Okay. And in this criteria, we have certain things. First of all, it's your personal relationship building skills, right? Now, this is the first criteria, personal relationship building skills. Then we have the information gathering skills. I will explain it to you in detail, all of the criterias. Then we have what we can say patient perspective, right? And the last part of this clinical criteria is the knowledge component. So let's begin with the first criteria, that is your PR skills, personal relationship building skills. In the first criteria, how would you start the card? Let's say starting the card depends upon few things, is the setting or the condition of the patient. So what type of setting it is, if it's the normal emergency, if it's the normal clinic, or it's the emergency setting. So your start could be, depending upon the fact where you are sitting in, and if you are seeing the patient for first time versus second time, or if it's normal condition or it's something emergency. At time we can pick the patient queue, like if there is a bleeding that can be seen, if there are some marks on her face, let's say if her eyes are red. So these are the cue. If the patient is limping, it's written in the card that your patient has red eyes, right? You can see the patient has bleeding from the right side of her head. Or if it has been written that there are some sign marks on her face or his face. So these are the cue that we have to see. So basically, if you can see there, as we are discussing about the greeting component of the speaking, specific to the scenario, when you are going to see the patient for first time, in this part of time, like what kind of tone you should maintain, you must have an appropriate tone with reference to the card, like if it's a normal situation or if it's emergency situation. According to the setting, you must adjust your tone. If your tone or language is not appropriate, you can be penalized with the false start, right? So you have to be careful for that. Apart from making an appropriate start with reference to patient condition, right? If it's not appropriate, you can be penalized with the false start. The first of all, the first thing, that how would you start the card, is quite important. Okay, here there is a frequently asked question. The candidates normally ask, like, how should we start, whether we should ask the name of the patient or not. So as per the OET guideline, they discuss that name should be discussed in the preparation time. So How much time we have for preparation? 3 minutes time per card. You have two cards, and then counseling time is 5 to 6 minutes time, right? Anyhow, if your start is not appropriate, you can be penalized with the false start. You will be given 3 minutes time to prepare the card, right? And 6 minutes time for counseling. During this time of 6 minutes, even this card will remain with you. Like you can see the card time and again, right? There's no like to rush on the things that they will take this card back from you. You can take this see the card during the consultation. So after your, you can say, PR skills that we just discussed. In this part, we discussed that how we greet the patient. Greeting should be appropriate. We can normally introduce ourselves by confirming your name and where you are sitting in. It's a normal introduction. Remember that I will repeat it again that this is just related to the speaking practice of a card of a scenario. For a normal setting, when you're seeing the patient for first time, we cannot implement maybe these statements with some other scenarios or setting, as we will be discussing different type of card in the classes in this week, and you would have an idea that how we can start a different card in different way. Anyhow, so after discussing the person after starting the card with the greeting, we do have the second thing that is the part of the greeting or the PR skills, is the rapport building skills, or in the communication is your icebreakers. Normally, we use the icebreakers in our communication to make other person in a comfort zone so that he can be close to you and we can have chit chat with them. But in this clinical medical practice, we use this rapport building skills or the icebreaker so that we can make sure that the patient would be comfortable with us and he or she can give you the information that you want, that you are intended to derive from the information. Because the steps that we'll be following on is the information gathering skills. If the patient do have a trust on you, like he or she can give you the information that you want to have. So it's quite important to use some icebreakers. Maybe you can discuss about the weather, if it's a pleasant weather or a sunny weather, depending upon the place where you are sitting in. We can also discuss about, let's say, the clothing the patient is wearing. The By appreciating nice shirt, we can also discuss about any local event in your place ongoing, right? Local event. So these are few things that can be discussed maybe in the icebreaker. But with red pen, I will be writing it's conditional to the card. We cannot use in emergency setting, right? We cannot use them in emergency setting. According to the situation, we learn with practice that how can we use these icebreakers, and it should be appropriate use. If you're not going to use these icebreaker appropriately, I'm afraid that you will have again penalty of inappropriateness, that you cannot use this thing appropriately, right? Anyhow, so after this rapport building, after we have this rapport building skills, we can see there we can move on toward the information, the one of the part of the information gathering skills, because there are some things that's come under the PR skills is the empathy, right? We have non-judgmental, that's come under the PR skills, but we are discussing it little differently. The sequence of the card that you maintain during your consultation. So first step will be the greeting. The second step will be the, you can say, rapport if it's conditional. The third step is the open-ended question. we can go for this is from the information gathering skills. Now, what are the types of questions you can ask in open-ended question? For example, let's say, how can I help you? This is also an example of open-ended question. Let's say, what bring you over here? This is also an example. And I just have gone through a file. I just have gone through a file and I came to know that you have, let's say, blah blah issue. So these all are different types of question that we can use when starting the conversation. And this is the point when we start taking the history, as we can say, this is your information gathering skills. The first part in the information gathering skills is to start the card with open-ended questions, such as "How can I help you?" is an open-ended question. "What bring you over here?" is an open-ended question. Or "I just have gone through your file and I came to know that you are having headache for the last 3 months. Can you tell me in your own words?" Like that. So basically, these are few example of open-ended question. So let's say if you're patient, you will get to know after the open-ended question about the nature of the patient, if it's a reluctant patient or if it's a talkative patient or what. So let's say after you had this open-ended question, you had an idea that the nature of patient is talkative. It means that the patient had given you the ample information. So right after that, you can go for the empathy, empathize. So now this is a one of the most frequently asked question. Candidates normally ask. Candidate normally ask. Candidate normally ask that what should we ask? What kind of statement would you use? What kind of statement would you use, right? So normally there is no something that you should memorize. There is no something that you should memorize. Why? Because you can see there you have to use the recapitulation skills. Recap mean just repeat the statement of the patient, but in your own language, right? So first of all, you must have an appropriate tone. Let's say, according to, you can say the temperature of tone. I would say the temperature of tone should be according to the gravity of the situation. Let's say if the patient is here for headache for 2 weeks and he's quite stressful, distressful actually. So we can say, "Oh, Mark, like it's totally relatable that you have been having pain." So just recapitulating what the patient informed you by using some statements, for example, with the help of tone. Okay, with dip over here in the tone. "Oh, Mark, it's totally relatable that you must be having severe pain," and recap. So basically, the next step in this part is to show empathy right after open-ended question. If the patient is talkative, empathy plus active listening. So now, if you can see there, if we have a patient who had given you the ample information, you have to empathize as per the scenario, and you need to show the active listening skills. Okay, if you can zoom this part like active listening, if the patient inform you, like I will be speaking this thing bit slowly so that you have an idea like what I mean by active listening skills. So let's say this is the record. Now I'm speaking. "Well, doctor, actually, I have been having pain in my right side of the head. It's quite severe, doctor. I cannot focus. I cannot concentrate. In the lights are something. It's quite irritating for me. I cannot drive even." So you can see the patient use right with low dip and patient use, let's say, uh, lights, for example, with low dip. So when the doctor will repeat with the help when you repeat actually these statements, First of all, you can say, "Oh, Mark, it's totally relatable that you must be having. It must be quite difficult for you to tolerate the headache for 2 weeks." So what you're saying that you have pain in at right side, right? So right with high tone, with this tone, and you're saying that it's irritating when you see the lights, right? So lights again with high tone. Why? Because we want to show the examiner that we have caught this dip. The patient show the dip. So when we are recapitulating, we have to show the high dip, right? So in case if we have talkative patient, we can show empathy with the help of the statement the patient inform you, just by adding some I would say like empathetic or sympathetic statement, and by recapitulating what he said in a summary form. No need to repeat each and everything, but highlight the major fact, what I would say the major. And beside that, if the patient had given you a dip, so try to like high tone to those things which has been delivered to you by the patient in depth, right? Anyhow, but if the patient is not talkative, he's reluctant. At the same point, you can see that we can redesign our consultation if the patient is not talkative, but if he is reluctant. So, in case after open-ended question, when you ask this question, I just have gone through a file and I came to know that you're having headache for the last 2 weeks. Can you tell me in your own words? So after say, yeah, it's quite severe. I cannot work. So you can see, I would have an idea now, the nature of patient is reluctant. So now I will not directly empathize the patient. First, I need to learn the nature or the like or the nature of the problem. I need to understand the full you can say gravity of the situation. So you will ask another open-ended question. Why? Can you tell me a bit more about your problem, please? Can you elaborate it a bit, please? So these are some questions that are the indicator to the examiner the patient was reluctant, and the candidate was quite adaptive in this response that he has not had. Uh, if the nature of the patient is reluctant, then we can go was reluctant. You have to ask another question. Can you elaborate it a bit, please? Right. So this is a kind of question that will make the patient to speak at length again. Right. So let's say we have discussed about the nature of the patient. If the talkative patient, then how would we respond to the scenario? And if it's the reluctant patient, then how would we respond to the scenario? But let's say if we have a talkative patient or reluctant patient, whatever the scenario is, after open-ended question, when the patient had given you the main issue, the presenting complaint, we can go for empathy followed by active listening skills. Now, in active listening skills, and then we can go to the close-ended question. Now, in close-ended questions, these are the collection of questions, first of all. So, what do you mean by the collection of questions? I would say the topic specific or disease specific. For example, in the collection of questions, they can ask you, they can ask you, let's say, or in fact, more importantly, you must show the range of grammar ever here in this question. So, what we do ask in the closed-ended question, remember that you're not going to use your own knowledge, but we will drive this closed-ended question maybe from the history part or from the task if it's not in the history. So you can use, let's say, some of the grammatical structure For example, how long you have been having this pain? How long you have been having this pain? So let's say, first of all, we have started with how. Have been having, it's a present continuous tense. We can use this question. We can also use, let's say, did you take any first aid? Did you take any painkiller? If your card allows you. So now, this is the past simple question, right? So, or then, let me remove this thing. We can also go for, let's say, have you consulted any doctor for that? This is also your present perfect tense. Is there any family history? Present simple. And the statement based question, what are the statement based question? Where we have the answer in the question. Let's say you have, or so if you can see, this is also a question that is in the statement form. The light can trigger this headache, right? But in this part, we must have stress on the last part of the word, like headache, right? So these are a few questions, and we can also have the eclipse question. Let's say, when we have two questions with or, we can also use these question in the card. So all these questions, as we discussed, the first one skill was PR skill. To repeat it for you, in the PR skills, we have to greet the patient, greetings. It should be appropriate. Then we have rapport building as per the card's requirement. Then we have the open-ended question. Then we have the empathy as per the scenario, followed by the active listening. Then we have the closed-ended question, and we have to see there should be range of grammatical structure that you have to follow. And if your card allows you to go for the examination, we'll go for the examination. As you can see, this is the dramatization of the real encounter, of the real scenario. So you just have to use these statements. Use the examination based statements only. For example, what we can use, let's say if you are going to conduct an oral examination, we can say, let's say, please open your mouth and say, let's say, poke out your tongue. I'm going to use this tongue, right? I'll try to be gentle, and so on. If you are going to conduct the physical examination, we can also use some statements such as hop onto the couch, please. Let's say, or please come to the couch. Let's say. Then we can say that if you can uncover your tummy. Okay. So I will be just like tapping your tummy. Just raise your hand if you feel any pain. I'll be definitely stopping my examination right away. Okay. So I'll be examining your tummy. Now I'm going to press or tapping your tummy on the right side. Okay, like that. You just have to dramatize the situation. Not necessary that you have to perform the examination. Actually, you are not performing it. You are just narrating the statement, right? So after examination, conditional to card, not necessary that you have to have the examination in each part. Conditional to the card, we can go for the next part, that is called the patient perspective. So let's say if you have to make the diagnosis over here, you can explore, for example, what patient is expecting, expectation of the patient. Normally, the card of yours has been integrated with the card of the patient, but at time we have seen that, like the patient might be expecting something out of the box, something totally 180-degree different from your diagnosis, but it's not mentioned in your card. It could be mentioned in the patient card that he might be thinking totally different, like disease, as you are going to make a diagnosis. Anyhow, so that's why if you have to see, you need to explore the patient expectation. For example, you have done the examination and you are about to make a diagnosis. If this is your diagnosis, now you are about to make a diagnosis, but before you can make the diagnosis, you can ask the patient, Mr. XYZ, what do you think what it could be, right? So we have to understand the expectation of the patient is quite important to be asked before you can tell the diagnosis. So we have to ask the patient expectation. This is your perspective part. If you believe that your patient is concerned, so explore the patient concern, right? Then the knowledge part. So no matter, there could be different type of card which could be related to the disease, for example, which could be related to any medical like certificate, for example, any medical sleeping pills, for example, uh, maybe any consultation, for example, and so on. No matter what, you need to ask the patient knowledge beforehand, even before you can tell the diagnosis, even if the patient would ask you about the medical certificate. So you need to ask politely, what is your understanding about the medical certificate? But we have to take the permission. Like, do you mind if I can ask you, what do you know about the medical certificate? Politely, you have to ask the patient knowledge beforehand. So after asking this thing, we have next task, that is information providing skills. So we are on the next task, that is information providing skills. In case of information providing skills, first of all, this is the first thing that you must have in your mind are the natural pauses, right? Okay. So we have natural pauses. Natural pauses that when you are explaining a task, you can see that there might be 2 to 3 points in the one bullet. Let's say if this is one bullet, there is medicines, for example, medical medicines. They can give you 2 to 3 points in that card. So you can use natural pauses over here. It's important. We can also have the sign poster changes. So what is the sign poster changes? Let's say if you have a major thing such as diagnosis and you are moving on toward the treatment, so use the sign poster changes over here. So there are 3 steps in the sign poster changes. You have to remember. It's quite important. Most of the candidates miss this thing. The first step in the sign poster changes is ask for the clarity, but not pointing toward the patient, but pointing toward you. Like, have I made myself clear? We should ask this: have I made myself clear? Right? But we should not ask Are you getting me? It's wrong, right? Are you following me? It's wrong. We should ask, have I made myself clear? Am I understandable to you? Or we can also ask, am I understandable to you? So the first step in the sign posture changes is the clarity. We'll go for the clarity. You should ask the patient, let's say, have I made myself clear? Do you want to ask any question? Okay, if you don't have any question, the second step is encourage the patient to ask any question regarding to the task such as diagnosis. And thirdly is to lead, or thirdly is the lead. First of all, ask for the clarity. Secondly, encourage the patient to ask question. Thirdly is to lead toward the next task. These are the sign posture changes. And we can also use the cohesive devices such as firstly, secondly, furthermore, consequently, therefore, hence, so, and so on. So I'll repeat this thing for you. The first one was the PR skills. In the PR skill, we have greeting, we have rapport, building skills. Then we have the information gathering skills. We have to see the open ended, then close ended, and we have empathy, active listening, and examination. If your card allows, then we can go for the perspective, which include concern, expectation, knowledge, and the last part is your education. And you have to educate the patient, involve the patient time and again, having the natural pauses, having the sign posters, having the cohesive devices, and encourage the patient. There are certain things in the clinical skills that you must understand. Use of layman language is important. You have to use the layman language. For example, we can use tiredness, our fatigue or lethargy, right? We can use heart racing, our palpitation. We can use, uh, let's say, throwing up, our vomiting. For let's say in lower part of intestine, for the descending colon, and so on. So first of all, it is important to remember that we must have the layman language, right? You should have the layman language in the consultation. Number one. Number second thing is, it is important also to remember, never interrupt the patient, right? Never raise your tone against patient. If the patient raises his tone, not in let's say abusive manner, just by some at time in the flow of speaking, the patient may raise his tone, so you have to be empathetic in response, right? So never raise your tone against patient. In the counseling part, we can also understand sequence the card as per the sequence of patient. Normally, it is being directed that you must follow the sequence of the card. However, if you believe that the patient is gonna break the sequence, let's say if you are on point number 2 and the patient asks you on the point of for 6, so you have to explore and address the concern first before you can come back to point number 3. So remember that sequence of the card is not that much important, but the sequence that you have to maintain for the patient is important, right? We can see there that we have a patient. Let's say, first of all, this is the setting, and there is a 24-year-old teacher who has come to your surgery today complaining of severe one-sided headache. This headache lead to nausea and have been occurring over the last 3 months. The patient report a family history of our trigger seems to be red wine, suggest migraine. So as I mentioned earlier, if you remember that this is the history part, background information, and this is the main issue that he is presented with you. So now, as per the clinical criteria that we discussed, that you have to start with the greeting, as this is something not life-threatening condition or normal scenario. So you have to start with normal card, like introduce yourself. Then you can ask the patient, and we can confirm the name of the patient in the warm-up session maybe, or in the preparation time. Then you can, or even you can confirm for the confirmation purposes. Can I confirm your name, Adil, please? Then we can start with the open-ended question. Okay, after settling the patient down, let's say, please have a seat. So you can use it. I have gone through your file. I came to know that you are having one-sided headache for the last, let's say, 3 months. Can you tell me in your own word, please? So we can use this statement as an open-ended question. Let's say in here, I just have gone through your file and I came to know that you are having 3 months history of headache, but can you tell me in your own words? Now, this was the open-ended question. As we start, like first introduction. Hello, my name is Dr. Blah and Blah. I'm one of the doctor in this suburban clinic. So, Mr. Mark, please have a seat. So, I just have gone through file. And I came to know that you're having headache for the last 3 months. Can you tell me in your own words? Like that. We can start with the open-ended question, right? So, after this open-ended question, you can see that the patient will tell you, well, yeah, or tell you, yeah, doctor, actually, it's quite fear. It's just around one side. It's somebody like hammering my head. I cannot focus, doctor. I cannot drive even. I cannot sleep properly. And I've just noticed that, it's quite severe in nature. Then you have to show the empathy. Oh, Mark, it's totally understandable that it must be quite distressful having this kind of headache for 3 months. Oh my gosh, it's quite overwhelming. But in order to better understand, can I ask you some question? Or if the patient had tell you about a one-sided headache, we can recap. So, Mark, what you're saying that it's just around the one side of your head, with the right side, and you mentioned that it's for the last 3 months, right? This was empathy followed by the active listening. Then we can go for closed-ended question. Let's say I know the answer myself before, but I will ask this question. Have you noticed any other associated symptom? Patient will tell you about nausea, or is it accompanied by nausea or vomiting? We can be specific. Okay. Do you have any positive family history? He will tell you. Okay. So apart from that, have you noticed any, like triggering factor or relieving factor? So these are the open and closed-ended question that I derived from the history component, right? Okay. So before I can proceed further, I need to see, as per the question that has been asked for the doctor by the Sir Sadaf, here there is no mention of examination directly over here, but it's just mentioned sign of neurological disease. So we can just perform some examination. Let's say, please follow my finger. No, can see right side or left side, whatever we can do in the card, not in detail. Before you can tell the patient, reassure the patient and discuss why you believe diagnosis is likely a cause. Reassurance means it's a hint for you that patient might be anxious about something. So before we can tell something about the patient, it's it's something you have to ask. What do you think? Politely. So, Mr. Mark, what do you think? What it could be? Because in my card, I can show you in the patient card. If you can see that patient is written that what I'm just telling you is quite important for you to understand. Patient mentioned that it's a tumor. It's not anywhere in your card. So, if you can see that the clinical criteria we discussed in the lecture today, if you did not, if you do not explore patient expectation, there is a possibility that this task will not be addressed by any means. If you just directly tell about the migraine and you move on, if the patient has not mentioned himself or herself about the tumor, this point will be missed. So, if we can integrate this point with the other point, before you can tell about the patient, about the disease, you have to explore the expectation. And this is an indicator for you. Reassurance mean before, like we can have reassurance for something the patient is anxious about, and we cannot see anything written in the card that patient is anxious about something. It means that there was a missing, you can say jigsaw, something like that. There was missing sample. So we have to ask about the patient expectation. Then you have to assure, Mr. Mark, let me assure you, less likely it could be a kind of tumor as per the clinical history, or less likely it could be something abnormal as of your belief. As per the clinical picture we have had, we believe that it's kind of headache, but we can say it's a migraine. So then explore patient knowledge. What do you think? What it could be, right? Then explain it in layman language what a migraine is. After explaining, we have a signpost changes. You have to ask the patient, have I made myself clear? Do you want to ask any question? Okay, if you don't have any question, I'd like to move on to the treatment option. Then you can discuss about the, okay, we do have two treatment plan. First of all, the preventive, and secondly, the abortive. Okay. Okay, let's say they ask you about the barbiturate. The patient mother was taking this medicine. You have to tell the patient that this is not a common practice these days because these kind of medicine are habit forming. But let's say if the patient asks you about the preventive method and abortive method, and I have no idea, let's say, about these, so you can tell the patient I will discuss with my senior consultant about these methods in details, and he will give you. After that, I will get back to you with the detail about the methods of preventive and abortive method, right? So let's say if you have no idea about the preventive and abortive method, no need to worry, because you can simply tell the patient that I have to discuss with my consultant first before I can get back to you, and I'll tell you in detail about the method. All I know is that there are some medicine and some techniques that you have to avoid. So in case of preventive methods, there are some things that you have to avoid, and in case of abortive, these are some medicine. But I would like to consult my consultant first, then I'll get back to you. So the point of ponder is that you should not worry about the things that has been mentioned in the card and you have no idea or no knowledge about that. So you could simply tell the patient, I'd like to consult